So moving forward, we get to talk about what is known as what the umbilical cord compression. All right. So just like the name implies, umbilical cord compression just simply means that yes, the umbilicus was kind of like what pressed against the wall, or you say against any structure. Compression is compression, right? But just so that, yeah, the umbilicus contains the veins, contains the arteries. So if it is compressed, right, blood supply to the baby, oxygen supply to the baby, removal of waste is basically impaired and all of that. So it occurs when pressure is applied to the umbilical cord. So this can reduce blood flow, reduce oxygen flow, all right, or obstruct it totally. All right. So it's a serious condition. It arises during pregnancy or labor, and while mild cases are common, most of the times it resolves on its own. Like, let me say, for example, if the placenta is wrapped around the leg of the baby or around the neck, sometimes if the baby keeps turning, it can loosen up by itself. You understand that kind of thing? So causes, what would be the things that could make the umbilical cord compress? We have things like what Nuchal cord. Alright, so if the cord is wrapped around the baby's neck, this is Nuchal cord. Alright, cord prolapse, the cord falls down into the birth canal, that's blocking the cervix. Maybe maybe the amniotic fluid is very low, so the baby wasn't able to be swimming freely and all of that. Then maybe uterine contractions are too strong. Alright, baby's movement or position. So signs and symptoms is there's if you check for the heart rate of the baby is abnormal, right? It could be slow, right? Reduced fetal movement, meconium stain, amniotic fluid. Maybe the baby got too stressed, had to pass the feces into the amniotic fluid. All right. So maybe the growth of the baby is restricted. So diagnosis is you are actually checking for the heart of the baby, to see the effect of this thing on the baby. Ultrasound or pelvic examination, Doppler studies. And treatment is, if it is severe, okay, if it is mild, just reposition, right? The mother reposition the baby, If it is moderate, all right, you put some saline into the amniotic fluid to make it more. If it is severe, then emergency cesarean sections could actually come in, right? Potential complications, right? Acid levels could get so high in the baby, oxygen levels could get so low. You can have brain damage. That's when like oxygen supply or blood supply to some parts of the body is not, or some organs of the body is not sufficient. So you can have their ischemia and all of that.